objectives for today. So first of all, I'd like to prepare your mind. So I'd like to make sure everyone understands their procedure, as well as what to expect before and after surgery in regards to pain management and physical therapy. And I want you to feel confident to ask questions. So at the end, like I said, if you're unclear about something, please don't hesitate to ask. Prepare your body. So I want to talk about the importance of a healthy lifestyle, not only before surgery, but also after. And then also talk about exercises that you can do ahead of time that will help with strengthening, which will help speed up your recovery after surgery. Okay? And then prepare your home. So I want to talk about home safety preparedness, the importance of discharge planning and medical equipment, and also the importance of the person that you're going to hear me call as being your coach. So that's the person that's going to be helping take care of you when you get home from the hospital. So we'll be talking about quite a bit today. Alright, so real quick I'll go over each procedure. First one is for those of you in here that are having a total hip replacement. I have a picture up here of someone that has a healthy hip and a bad hip. On the far right we have a big hip that has arthritis starting to break down on the cartilage. It creates that bone-on-bone pain and the pain, the groin pain that you all experience when you walk, which of course gives us the reason to have to replace the hip. Okay, the implants look like the far right picture I have up here. These implants are made of titanium. There are two parts that fit together, so there's a ball portion here, so your surgeon's completely replacing this part. And then there's a stem portion that actually goes down into your femur, so that's the long bone in your leg. The two fit together and give you that normal rotation in your hip that you're used to. Okay? Something important for all of you to know, not just hips but knees too. At your first post-op visit, you should get an implant card from your surgeon. Okay, it's a little card that has the information on what type of implant, when it was put in, the type of metal, and it's good to keep that on you at all times because some metal detectors are sensitive enough to go off if you go through them, like at the airport and stuff. Also, if you need to get an MRI done down the road, they're going to want to have proof of that card to show what kind of metal you have inside of your body. So just keep that in mind. They should give it to you, but you may have to ask for it. Okay? For total knee replacement, so here on the left we've got the normal knee, healthy pink cartilage. Here in the center we've got an arthritic knee. The cartilage is starting to wear down from the osteoarthritis. And then on the far right we have a picture of the replaced knee. So just like the hips, these are made of titanium. Okay? And just to give you another view of what a total knee looks like. These two parts of the implant fit together. And then we have one part that attaches to the bottom of the femur, so that's the big bone in your leg, so the lower part of your femur. And then another portion that attaches to the top of your tibia, so the big bone in your lower leg. Okay? They come together and give you that normal hinge motion that you're used to. And then your patella, so the bony portion of your kneecap, of course, that goes back. So the part that you feel when you feel over your knee, that's what it will look like, okay, once the replacement's done. So a partial is just like it sounds. You might hear it called a partial uni, sometimes Mako, depending on the type of surgery you're having done. But it's essentially a half of a total knee replacement. So your surgeon has identified an area in your knee that may have some healthy cartilage and they only have a need to replace half of the knee. So that's, of course, what it is up here. Okay, these are also made of titanium, so just like the other knees, you'll get a card. Just to give you guys a comparison, this is a total versus a uni. So you can see here on the left, we've got the total implant, which covers the entire knee space. And then the uni partial knee, we only have half of an implant in the knee space. So that's what it will look like. Okay. Alright, preparing for surgery. So I'll go ahead and tell you the booklets that I've handed out before class are yours to keep. So feel free to write in them, jot notes in them, whatever you want to do. Everything that I go over in this class is in that book. So I encourage patients when they get home, if you have time, to read it from cover to cover. It's got lots of good information about what to expect, day 1, day 2 after surgery, preparation, home safety checklist, all those kinds of things. So really, if you have time, please read it over when you get home. Every patient, we like patients to identify a caregiver coach, so that's the person I was talking about. When you get home from the hospital, that will primarily be helping you when you get home from the hospital. If you haven't already identified that person, this is just a reminder that we see patients do well when we have that coach that can kind of be a part of the recovery process after surgery. And I'll talk about in another slide when we get to PT on how we like that person to come to physical therapy at the hospital, at least for one visit. Sometimes this person is a spouse, family member, friend, neighbor, someone that goes to your church, someone that you're really close with. So just, if you don't already have that person, a lot of you have people here with you today, so it's probably not an issue. But if you don't have that person yet, that's a good way to maybe start thinking of someone. All right, in your guidebook, there's a few things that I would like to point out that are probably really important. So the first thing I'll say is the home safety checklist. So on page 6 in the hip book and page 7 in the knee book, this is an especially important list for those patients that are going home directly after your hospital stay. So occasionally we have patients that have a need to go to a rehab facility after they leave the hospital, but the majority of patients end up going home when they leave the hospital. So this list is very important because we want you to prepare your home from a safety standpoint before you get home from surgery. So this list kind of begins that for you. So start thinking about things that can be hazards in your home. Or do you have things that are easy to trip over? Throw rugs, cords on the floor. Do you have small pets that are easy to trip over? Can you clear your hallways with your walker? Can you get in and out of your bathroom safely? Is your toilet low to the ground? Is it difficult to get up off of? So we may have to get you equipment if it's low. Do you have a space to hold on to or sit in the shower? Do you have stairs? So these are all good questions that we like patients to start thinking about, because if we know from a standpoint from when we call you, we can go ahead and arrange your medical equipment, resources, things like that if you need them, if we know about it. So if you have time, go over that list ahead of time. We really encourage patients to do that. Advance directives. If you have an advance directive or living will, any sort of legal medical paperwork, and the hospital does not already have a copy, or you didn't bring a copy with you today to the lab to put into your charts, please make sure to bring it with you day of surgery. This is very important. We want to have on file whatever your wishes are if you have them. Of course, if you're a patient that doesn't have an advance directive or living will, it doesn't apply. But if you do have one, please make sure we have it. Smoking. So first of all, smoking at Mission Hospital, we are a non-smoking campus, so we don't allow smoking at Mission, not for patients, employees, family members, friends, people coming to visit you. So I sometimes like to give patients a friendly reminder that you may want to let your family members know that if they're smokers, that if they come to visit you and they have to go outside to smoke, they're going to have to get in their car and leave to smoke. We don't allow it on the campus, so that's kind of like a courtesy thing. The other reason I'm bringing it up, of course, is because if you're a patient and you're getting ready to have total implant surgery done, and you are a smoker or you use nicotine of some type, we encourage patients to quit before surgery. There's several reasons for that, but the most important reason is nicotine is really poor for healing. So if we're getting ready to, do this surgery on you and we want that bone and implant to heal and we want your incision to heal correctly, the nicotine can impede that process. So this just applies, of course, if you're a smoker or if you use nicotine, but just an FYI, if you can, we like patients to quit before surgery. All right, so now I want to talk about exercises. So on page 20 of the knee book and page 15 of the hip book are some exercises. So if you do not have time to read your book when you get home, from cover to cover, at least read these pages, okay? These exercises are very important and you will see them again. You'll see them with inpatient therapy when you do PT at the hospital. You'll see them with your home health therapist and then again with your outpatient therapist. So we really like patients to review them ahead of time, kind of think about them in your mind, the body mechanics and all of that. An added bonus would be if you can practice them. We encourage patients to try to strengthen as much as possible before surgery, and these exercises are a good start to that. So if you're able to, try to strengthen the opposite side of your surgery. So if you're getting ready to have a right knee or right hip done, it would make sense to strengthen the opposite side because that right side is going to be down for a period of time. So if you can strengthen that opposite side and also strengthen your upper body, you're going to be using those arms and shoulder muscles quite a bit to pull up out of the bed, out of the chair with that walker. So just know that you're going to be using lots of things that you may not use now. And if you can do any sort of strengthening, all it's going to do is help speed up the recovery process. All right, medical equipment. So I want to talk about what type of medical equipment is typically needed, and then how to get it if you need it. So the one thing that's on this slide that every patient needs is the two-wheeled walker, right here, this one. So if you currently have a walker at home and it has no wheels at all, then we'll have to get you one with at least 2 wheels in the front. If you have a walker that has 4 wheels, like a rollator that has the brakes, the seat, all of that, those are actually okay to use, as long as they have a minimum of 2 wheels in the front. We don't like crutches, so if you're thinking about crutches after surgery, we typically discourage that because they're not quite as safe with physical therapy, so we do encourage the walker for patients when they go home. The other pieces of equipment I have up here, these are things that patients may or may not need depending on your home situation. And some of these things are covered by insurance, some are not, depending on your plan, so the plan that you have. So I'll go ahead and tell you these two here. So first of all, this one's our toilet seat raiser. So if you live in a home that has a commode that's really low to the ground, it's a good idea, especially if you're having a hip, to consider raising your toilet somehow. These two pieces of equipment can do that for you. This one's just a regular raiser, that's all it is. It sits on top of your toilet and that's what it's for. And then this one here, the 3-in-1, actually serves 3 purposes, but it also serves as a raiser. So you just take this bucket out, sit the entire thing over top of your toilet, and you can adjust the legs here and raise the height if you need it. Another thing that sometimes patients need is a shower bench, so that's in the top right-hand corner. That would be for someone who doesn't really have a safe space in the shower. So if you don't have somewhere to sit or to hold on to, you might want to consider getting one. Okay? The bottom right here, like I said, it serves as a bedside commode, a toilet seat raiser, and a shower chair. Okay, so you can use it in any capacity for all 3 of those things if you need a shower chair and a elevated toilet seat. What I will say, just from past experience, is that the walker is typically always covered by insurance when you're having surgery. And this one, the 3-in-1, is typically, for the most part, covered by most insurance plans. The other 2, the standard shower and toilet, is hit or miss, depending on your plan. So you the patient, it may be that we have to send that order in, and if it ends up being that you have to, it's not covered, it may be out of pocket for you, if you want that particular kind. But a lot of times we don't know until we send the order in. Okay? So that brings me to, how do we get this stuff? What's the most common ways that we get it? First of all, I encourage, try to borrow if you can. If you know someone that's had surgery, that has this equipment, always try to ask around and see if there's anyone that you can use their stuff. There's another one in Hendersonville called Medical Loan Closet, and they have the same thing. It's a loaner closet. So Medical Loan Closet, I think, charges. So the church is like that. It sounds like it's just like a rental type thing. You just bring it back when you're done. So those are good options. Also, Habitat for Humanity, Goodwill, places like that in the community tend to have stuff like this as well. The most common way I see this equipment getting ordered for patients is through the practice. You would speak to a representative at the office, and they would get that order for you. And then that distributor, whoever they send the order to, would call you to either have you pick it up or delivered to your home. So that's the most common way I see it done. All right, day of surgery. So I want to make sure everyone knows where to go day of surgery. So just to be clear, everyone's having surgery at Mission Memorial Hospital. Okay, we don't operate at St. Joe's anymore. So everyone should report to the main hospital, Mission Memorial Hospital, morning of surgery. All patients are to go to the main entrance to check in. We used to have an old OR entrance. It's actually blocked off right now with construction. So it's the visitor entrance where you would go to visit someone at the hospital, where the coffee shop, gift shop, all of that is. You're going to check in at the front desk, let them know that you're there for surgery, and they're going to direct you to a waiting area that's off to the right, where you and your family members can sit. They will do a quick registration with you, so make sure to have that driver's license and insurance information with you. They should have it already for the most part, but they do want to verify things. During that process as well, you're going to receive a blue piece of paper. It's a light blue piece of paper. It has a number attached to the top of it. We call this number the patient's tracer number. The reason this is significant is because for the visitors that are waiting on their family member when they're in surgery, we have a monitor that the family members can look at and see where your family member is in the process of surgery. So that number is a confidential way for you, the family member, to look up there and say, well, this is her number, she's still in surgery, or she's in pre-op, or she's in recovery. So you can kind of see where they are in the process. So sometimes that piece of paper gets lost in everything else that you get. So just know that that's what that form is for. You can have one person go back with you to the surgical pre-op area. So that's when you get your IV put in, talk to anesthesia, get consent signed, all of those things. Of course, when you go back to surgery, when they take you back to the operating room, your family member will be brought back out to the front where that waiting area is. Okay. We have moved valet parking to the main entrance. The reason I put this up here is it's free on the day of surgery for surgical patients. You just pull up to that valet and they'll park your car for you. I do know that their hours are 5 a.m. to 5 p.m. So if you're going to be past that 5 p.m., you'll probably want to get back before then to get your car. Let's see what else. Patient belongings. So the belongings that you have with you, so the clothing that you wear in, and then anything you bring with you, like for an overnight stay, will stay with your family member while you're in surgery, unless there's no one there with you when you come to surgery. So if you're one of these people driving yourself, someone's coming later, or you're being dropped off, someone's coming later, and no one's there to physically hold your belongings when you're in the operating room, then we'll have to check them into security. Okay, and that's something that they do in the pre-op area. They'll check it into security, and then you get them back when you get to your room. Okay? But for the most part, people typically have someone that is waiting on them. Okay? So just to be clear, I like to show a map too, because it can be a little confusing on where to go. So right now we're in this building, we're in One Hospital Drive. Across the street is St. Joe's. This is not where we're going morning of surgery. We're actually going to Mission Memorial Hospital, and we're coming in off of the Victoria Road entrance, morning of surgery, to check in. There's a stoplight there. There's actually this new statue that they just put up that you'll see when you pull up. You're going to pull in, and you're going to pull around to the second pull around where the triangle is. Okay, the parking deck is right out front. If you accidentally come in off of the Biltmore Avenue entrance and you see the ER signs and the Heart Tower signs, just know that you're on the wrong side and you'll want to loop around to the other side. Okay? Alright, what should you bring with you? We want you to bring your education guidebooks, so the booklets that I've handed out for class. Please bring those with you. We want you to bring comfortable clothing. We want you, the patients, to wear clothing that is comfortable to do physical therapy in. So we try to discourage patients having to wear gowns in the hallways and in the gym. So whatever that is to you, we encourage you to bring it. It should be loose-fitting, comfortable, breathable, easy to put on, take on, or put on and take off. And also shouldn't be tight around your incision, around your knee or your hip. So whatever that is to you, we have patients do shorts and t-shirts, pajama top, pajama bottoms, whatever you want to bring for that is fine. Low-heel, non-skid walking shoes. We want you to have shoes that are comfortable but also safe to do therapy in, okay? They have to have that tread on the bottom so you can't slip and fall. And they do have to cover the top of your foot. We don't like flip-flops or sandals that toes are showing, so they do have to cover the top of your foot. They don't have to be athletic type shoes, but they can be if you want. Sometimes we patients bring slip-ons. As long as they have that tread on the bottom, that's fine. Any personal care items, so anything that you will need at the hospital for an overnight stay. So toothbrush, toothpaste, change of clothes, change of underwear, I mean whatever you want to bring, you can bring in that overnight bag. I will tell you, you don't really need to bring a whole lot. I would think pack light and don't bring a lot of valuables because it's easy for things to get lost in the hospital, so just keep that in mind. And then if any of you use a CPAP at night, a breathing machine, that is one thing we want you to hand over to the nurse when you check in at the hospital. We don't want you to leave it in your car or at home. They're going to use that machine on you when you wake up in recovery, so just make sure that the nurse knows that you have a CPAP and give them the machine. Okay? And then there is a complete list on page 8 of the HIP book and page 10 of the knee book. But everything that I just went over is the essentials to what you should bring typically. typically. Is anyone planning to be same-day discharge? Okay. So something a little different for patients that go home the same day. Those of you spending the night do not have a need to bring a walker into the hospital with you because you're going to use the equipment that they have in the hospital room for your therapy. The only thing that I would suggest is maybe put it in the trunk of your car to have maybe on your drive home. But for the most part, you won't need it in the hospital. For same-day discharge, you will need to bring your walker because we're going to do therapy with you in the post-anesthesia unit, and we do need to have that. The therapist is going to come to you, and they're going to adjust your walker and all that, so just make sure to have that with you. All right, what to expect. So patients go from the recovery room to the inpatient nursing unit. You can expect to be up and walking and in the chair for meals day of surgery. So we're very proactive about getting patients up and out of the bed and moving and getting them to the bathroom. So just so you know, that happens pretty fast. Patients typically have their first PT session the same day they have surgery. Okay. You can expect 1 to 2 nights in the hospital. I'll tell you the majority of patients go home that first day after. They either go home same day or they go home the day after. Sometimes patients need longer, depending on the situation. It's not always cut and dry like that. But for the most part, patients end up going home in that 1 to 2 day window. And then they end up with home health physical therapy or outpatient therapy. So typically, patients end up with about 1 to 2 weeks of home health PT. We send a therapist out to your house 2 to 3 times a week for about an hour at a time. And then once you have graduated the home health, we set you up with outpatient, which is where you go somewhere, outside, a PT office somewhere close to where you live and do PT. But that's if you need it. Sometimes we see patients do that course of home health and they're doing really good, doing all their exercises, and they don't need more. And then we have some patients who need more. So it just depends on you, the patient, and the situation. Occasionally, I have patients who want to go directly to outpatient, so they want to skip over the home health part of it, which is fine. But when we call you to make those plans for you, we're going to make sure that you have transportation, because we're not going to let you drive right away after your surgery to go to an outpatient place. So as long as you have a committed person that can drive you 3 times a week for therapy, then we're happy to set you up with outpatient first. Okay? All right, attachments after surgery. So when you wake up in recovery, you're going to have lots of lines and tubes, lots of things going on. Just know that all of these things come off pretty fast because we want you to be mobile. We want you to be able to get up on the unit, do physical therapy, and not have to drag things with you. So just know that you can expect to have an IV pump with fluids going when you first wake up. All of that stuff's going to come off as soon as you're tolerating fluids normal. You may have oxygen going through a nasal cannula. This is just due to oxygen saturations dipping down from anesthesia. It's normal. But as soon as those get normal, we're going to take that off as well. You can expect to have vital sign equipment going, so you'll have that blood pressure cuff and finger probe on your finger for the first 24 hours. That blood pressure cuff will go off every 4 hours, typically. Okay, and after that, it comes off. And then compression devices on your feet. So you're going to have those bilateral compression stockings that go below the knee on both legs, and then you'll have the machines that squeeze your calves for circulation. Okay, so it sounds like quite a bit, but all of that stuff comes off pretty fast. Because, like I said, we want you to be mobile for physical therapy. So that brings me to my next topic, physical therapy. So every patient, regardless if they're going home same day or spending 1 or 2 nights at the hospital, you all have the same criteria you have to meet before we let you leave the hospital. And your therapist, their main goal for you is preparation and safety for home. Okay? Before you leave the hospital, you're going to be able to walk with your walker. You're going to be able to do stairs, go up those stairs and go down the stairs. Get in and out of the car safely. Do your exercises. And then caregiver coach participation. So that brings me back to what I was saying earlier. We see patients have really great outcomes when we're able to coordinate at least 1 PT session with the coach. So the person that is taking you home and going to be helping take care of you when you need it, we see really good outcomes when that person gets the same message that the patient does in regards to therapy. So if you're able to, the best way to coordinate is through the nursing staff. So that morning when the nursing staff come on shift, I would just ask them, what time is my PT assigned for today? And they can let you know the time so that you can let your family member know when to show up for the PT. All right, these pictures that I have up here are actually from our gym at Mission. So those of you that are spending the night, you'll see the gym. And you can see here we have several things that we do to practice. We've got the stairs and then the car that we practice with patients during their PT. For same day, it's a little different because the therapist comes to you, but they go over all the same things that the patients get that are spending the night. Okay. All right, pain management. So another important part of your recovery after surgery is pain management. So just remember, you're going to hear this scale, about the scale quite a bit from the clinical staff. They're going to ask you to rate your pain. And what that means is on a scale from 0 to 10, what would you rate your pain? 0 means you have no pain at all, and 10 means you woke up and you are in the worst pain you've ever had in your life. So it's trying to figure out where you are on that scale and communicating that with the nursing staff so that they can provide you pain medication as needed. Something that I've learned with ortho surgeries is that it's very important to stay ahead of the pain. So if you're prescribed something every 4 to 6 hours, it's really ideal to try to stay on top of that regimen, especially the first few days after surgery. Of course, we don't want you falling asleep in therapy and not able to keep your eyes open, but we want you to be somewhat comfortable. And the reason for that is PT is so important those first few days after surgery, and if you're in 10 out of 10 pain, we're not going to get much therapy accomplished if you're hurting that bad. So just remember, try to keep track of the last time you took your pain medicine yourself if you can. You may have to call out to the nursing staff. They get busy. They may not make it right in there at that time, so you may have to call out. Make sure to communicate with the nursing staff what it feels like to you as far as on the scale. And we should be able to keep your pain managed at that point. There are other things that we suggest for pain other than pain medication. A big thing is ice. So I'll tell you guys, it's not uncommon for several weeks after surgery to have generalized swelling after the surgery. So not just in the knee or the hip, but in the entire leg that had the surgery. Okay? And that swelling is going to ebb and flow with your PT. You're going to get up in the morning, feel pretty good. Go do some PT, do your exercises, and then when you go to rest again, your leg might be, a couple sizes bigger because it's swollen. And that's normal, but the way that we combat that is ice and elevation. Okay? So ice and elevation is the best thing that we can do for that. These two pictures that I have up here are actually specific to knee patients. These are the ice packs we get out to knee patients. These go home with you. And then the wedge pillow we use for elevation for knees. So those wedge pillows help get those legs above the heart and also keep the knee completely locked and straight because we don't want pillows under the bend of your knee. So just keep in mind, if you get ice packs for your knee or your hip, these go home with you. Don't leave them at the hospital. They're yours to keep. So make sure to take those home with you. The same goes for the wedge pillows. Those of you having knee replacements, you will get a wedge pillow. They go home with you. Okay? Hip replacements, we don't use wedge pillows to elevate, we just elevate with pillows. So you shouldn't get a wedge pillow. And you'll get regular ice packs that lay on top of your incision, but those go home with you as well. When you're icing, also just keep in mind, you shouldn't be icing more than 15 to 30 minute increments at a time. Okay? It is possible to over ice. So when you are elevating and icing, just put that ice pack on for about 30 minutes, take it off for a little while. And then you can put it back on later. Okay. Relaxation. If there's anything that helps you relax that you can bring with you to the hospital, we encourage that. So music, books, anything like that you want to bring. We do have access to Wi-Fi at Missions. You can, log into that and listen to your music or play a game or something like that. So if there's something that helps you relax and you want to bring it, feel free to bring it with you. All right, Preventing complications. So a complication you all are at risk for post-op is a blood clot or a deep vein thrombosis, DVT. It's called several things. First of all, I want to talk about what we do from a front end to help prevent these, what the signs and symptoms are, and what to do if you develop the signs and symptoms of a blood clot. So every patient for 2 weeks after surgery should be wearing compression stockings, below the knee compression stockings. You're going to get these from the hospital, so make sure they go home with you. But you should wear them on both legs during the day when you're doing PT and getting up and moving around during the day. We do see patients sometimes that want to take them off at night during periods of rest, and we actually encourage that if you want to. So feel free to take them off at night, but you should have them on during the day. Okay. Perform ankle pumps and circles. Remember to consciously just move those feet and ankles around, pump that blood back up to the heart. When you're sitting or lying down, it's just going to help keep the circulation moving and decrease the risk of this. Every patient for 2 to 3 weeks after surgery will be prescribed a blood thinner. Okay? There's lots of different types of blood thinning medications. I'll talk about those in a slide coming up. Some patients are on different meds than others, and the important part is that you are on something. Not specifically what you're on, but that you're on something. So if you go to get that discharge paperwork from the hospital and no one talks to you about aspirin or some sort of anticoagulant blood thinner, then that would definitely be a red flag. All patients get that medication when they leave the hospital. And then stay active. So the more you can get up and move around, the less likely you are to develop a blood clot. So just remember, activity helps everything, and that's one of the big things, is getting up and moving around. So now I want to talk about the signs and symptoms. The reason we like to educate about this is typically, you're not going to develop a DVT, or we're not going to know about a DVT until you get home. Is normally the way it works. It's not going to be when you're in the hospital surrounded by nurses and doctors. It'll be when you get home. So we want you to be familiar with what those signs and symptoms look like so that you can call us at the office. So if you develop any redness, swelling, warmth, or pain in the calf of your leg, so that can be either side of your leg. So sometimes we have patients who develop a blood clot in the leg that did not have surgery. It rarely happens, but it does. It does occasionally happen. So just keep that in mind too. If you ever notice the symptoms in the opposite leg of the surgery, that could be a blood clot. Also, if you develop these symptoms, what do we want you to do? We want you to call the practice. Asheville Ortho. There's always a doctor on call, someone available to talk to you about this. The way we're going to rule it out is send you for an ultrasound. Okay, and if that ultrasound is positive for a blood clot, we're going to treat you with more blood thinning medications. That's how we treat them. The only time that I would ever be concerned that this would be considered a really serious problem, like ER or 911 kind of thing, is if you ever develop difficulty breathing at the same time, and that could indicate that part of that clot has broken off and traveled to your lung, and that's called a pulmonary embolism. It's rare, but it could happen, so we like patients to be aware. So if you ever notice those two things together, that's definitely a serious thing and you should bypass the office. But for the most part, if you just have the calf pain or something going on with your calf, call the practice. We'll be happy to walk you through it and send you for that ultrasound. So what do the medications look like, the blood thinning medications? So there's several different types of medications. There's different ways that we decide what you're prescribed. First of all, surgeon's preference can go into it a little bit, as well as your past medical history. So if you're a patient that is already on a blood thinner or have some sort of cardiac arrhythmia like AFib, you might be on a medication like this. So what you're on might be different than someone who doesn't have a cardiac history. If you're relatively healthy and don't have much of a past medical history, you might be prescribed aspirin 325 a day. And then we have stronger medications like anticoagulants like Coumadin, warfarin, Lovenox, Eliquis, Xarelto, Plavix, Pradaxa, to name I think that's all of them, that you may be prescribed. Most common side effects with these drugs are bleeding and bruising, so minimal bleeding and bruising. Okay, so what I consider minimal or minor bleeding is, of course, nosebleeds, bruising, bleeding gums. I would consider all of that minor. Anything here under the red, change in urine color, stool color, vomit in your blood, or blood in your vomit, bleeding you cannot stop after 20 minutes, and then coughing up a blood. That's all pretty serious stuff. So if you ever notice that happening or any of those signs or symptoms, you should definitely go to the ER or call, depending on the severity of what's going on. While I'm talking about bleeding, you all are going home with an incision to take care of, so you'll have a daily dressing change over your knee or your hip. Something that is not normal is if you notice that your incision or like your dressing keeps bleeding through. Like you change your bandage for the day, you look down and it's got that red shadow again, you take it off, change it again, it's bled through again. It could be the medication that you're on, that we have you on for blood thinning medication. So just know that the dosing might be off, it might need to be adjusted. So if you ever notice that happening, you should call the office. Okay? Because that's not normal. You're going to have some drainage, but not like that. Alright, so while I'm talking about incision care, the best way to prevent infection is hand washing. So anytime you, family member, friend, healthcare worker, physical therapist, anyone's going to touch that incision, change the bandage, we should always wash hands before and after. Hand sanitizer, soap and water. Okay? The specifics on how to take care of your incision will come at discharge. So how to change the bandage, how often, what kind of supplies, when to shower, when the staples come out, all of those specifics will come the day that you leave the hospital from the nurse. Okay, they're going to go over all that with you. What I want you to be aware of today are signs of infection. So we want you to look for things that, when you get home, things that could indicate an infection. Fever over 101 for a period of time, accompanied by increased drainage, increased swelling, redness or pain in your incision. So the thing I always say about incisions is sometimes patients are unsure, they're really anxious about it. We would prefer that you call us. Even if it's not infected, we would prefer that you call us and let us check or talk you through it over the phone than it be something really serious and you not call us. Because it can quickly turn into a big thing. A small thing can turn into a big thing if we don't know about it. So if ever in doubt, call the practice. Okay, remember, there's always a doctor on call. One thing, too, that I want to mention about incisional that I can tell all of you is you cannot swim until cleared by your surgeon. So we can't get in pools, hot tubs, bathtubs, jacuzzis, any type of stagnant water. We don't want to submerge that incision in water like that until cleared by your surgeon. Okay, we're going to let you shower after a period of time, letting clean water run over top of the incision. And those specifics will come at discharge, but that's typically the only thing we let you do as far as getting it wet. We don't want you to put it in water, like in a body of water. Okay? Alright, another complication you're at risk for post-op is pneumonia, so just keep in mind you guys aren't moving around as much, you've had anesthesia from surgery. Things tend to build up easier in our chest, those secretions. And it can be difficult sometimes to get them up, especially when we're, already down a little bit from having surgery. So the best way to help prevent the pneumonia is using this little machine here. It's called an incentive spirometer. You're going to be given one at the hospital. These should go home with you, and you should practice them for 2 weeks after surgery during periods of rest. Okay, so when you're laying down and watching TV or just resting for a while, you should pick it up and puff on it a couple times. If you do it correctly, it's going to make you cough, and that's the intent. We want to cough up whatever has settled in your chest, settled in our chest from the anesthesia or not moving. So just keep that in mind. We don't want you to pick it up and do it when you're in PT, because that's kind of silly because you're already up moving around. But when you're resting or lying down or things like that, just remember, practice it. And then activity helps as well. Preventing constipation. So the #1 phone call that we get calls about after surgery is constipation. Okay? So you guys, I'm going to tell you, you're at a very high risk for constipation. You've had anesthesia, you're not eating and drinking as much, you're not moving as much, and then we throw those opioid medications on top. So those really strong narcotic oxycodone, hydrocodone type medications. So it puts you at a really high risk for constipation. We encourage all patients to take these 2 medications twice a day, okay, breakfast and dinner, during the period of time that you're taking narcotics, okay? They don't have to be the specific brand, Miralax or Cineplus. we just encourage that you take 2 medications that are like that. Miralax is a powder form laxative, and then Cineplus is a stool softener. So the 2 taken together work really well and keep patients regular. Also, remember, increase your bran, water, fruit, fiber intake. All of that will help. Okay? And also, remember, once you wean off of those strong medications, the strong narcotics, you would want to do the same with this. Okay? So when you stop taking the oxycodone and now you're just taking Tylenol, ibuprofen, you would want to do the same with this, because it's going to create symptoms of going a lot if you don't wean down on that as well. Okay? Preventing falls. So when you are on the unit, we don't want patients to fall. So please make sure to call out before you try to get out of the bed. Okay? We want someone from the nursing staff, CNA, nursing, PT, to be at your bedside when you get out of the bed. Okay? We don't want family members trying to get you out of the bed. We want the staff to get you up. Use that call bell to call out, to get up, and use your walker and stand up slowly. Okay? We do use bed alarms on the unit, so if you forget and happen to try to get up, the bed alarm will go off and you'll have about 10 nurses running the room. That's been known to happen. So just please call out, and if you need to get up, we'll be happy to help you. All right, medication safety. So morning of surgery, we want all patients to bring an up-to-date med list with the medications they take to when you check in at pre-op. If you haven't received a call yet from the anesthesia pharmacy department about what medications to take morning of surgery, which ones to hold, just know that you will get that call. It's a standard call that all patients get. And sometimes patients ask me if they should bring their pills with them to the hospital. There's no need to bring your pills with you to the hospital. That's why we do the list. So just make sure that list is up to date, and we will give you whatever daily medications you need when you're in the hospital. Okay. All right, day of discharge. So your surgeons round early. They round around 7:30 every morning. They'll come in and talk to you. And if you have met your PT goals and everything looks good and you feel ready to leave and they feel good about you leaving, they'll put that order in for discharge. It's not as simple as being discharged and you can just leave. There's several things that have to happen before you can leave the hospital. You have a care team assigned to you. So you have a physical therapist that has to do a final evaluation with you, make sure you can do those stairs and that you can walk a certain distance and that you can get in and out of the car, all those things. The discharge planner is going to make sure everything's been arranged, that your home health's been arranged, that you have your medical equipment that you need when you get home, all of those questions that you might have. And then the registered nurse goes over everything else. So dressing changes, when to call the doctor, when your follow-up appointment is, what your anticoagulant is, what pain medication you're going to be taking, and how often. So all those little questions that you're going to have about when you leave the hospital, they'll go over everything else.
What's the typical stay for a hip replacement? A day?
Yeah, a day. Yeah, 1 to 2. Typically, most go home the day after. Yeah. Let's see. We do offer bedside prescription delivery service. So for patients that receive a paper narcotic script and they don't want to have to stop at the pharmacy on the way home to get it filled because we can't call it in, then we can fill it for you in the inpatient pharmacy admission while you're waiting on everything else, like for discharge, and then bring it to your bedside before you leave. So if that is something you're interested in, it's called Meds to Bed, and what we need from you is your driver's license and whatever your copay is for your prescriptions. Okay, so just let the nurse know if you're interested. And then if you need to know a specific transportation time, I would just ask the nurse. They typically know of when you can be out. All right, so there's a few things that I'd like for you to take away from today about your joint, your new joint. So just remember these few things. Remember to always change positions often and keep moving and exercising. Physical activity is the best thing you can do for your joint. So the more you can get up and move around, the better. Steadily increase your walking. So gradually increase the distance that you walk each day. Okay? I would set mini goals, not huge goals, not like 5K goals, but like we're going to walk to the end of the driveway today goal, and maybe a little bit farther the next day, things like that. Continue to elevate and ice as needed. Remember, you're going to have that swelling. for a few weeks after surgery. The best way that we combat that is ice and elevation. Ice and elevation. Keep all your follow-up appointments. If you have a follow-up appointment already scheduled, and most of you probably do for your first post-op appointment, and you can't keep it, please don't no-show it. Make sure to call our practice and reschedule. That's a very important appointment. We do x-rays, check your incision, all those things. So if you can't keep it, make sure you let us know. Eat healthy, do not smoke, and drink lots of fluids.